Hi, my name is Maggie, and today I'm going to discuss the golden age of public health. In his book, The Social Transformation of American Medicine, Paul Starr states that, in retrospect, the turn of the 20th century seems to have been a golden age for public health when its achievements followed one another in dizzying succession and its future possibilities seemed endless. For background, in 1920, Charles Edward Winslow, a Yale public health professor, defined public health as the science and art of preventing disease, prolonging life, and promoting physical health and efficiency through organized community efforts. Winslow also reflected upon the fact that there were three phases of public health development. Phase 1, from 1840 to 1890, emphasized empirical environmental sanitation. Starr remarks that in the early 19th century, public health was more closely linked with engineering than medicine and focused mostly on cleansing the environment of filth, as impurity is what led to disease. Phase 2, which followed until the early 20th century, focused on applications of bacteriology and emphasized isolation and disinfection. The Bacteriological Revolution, which occurred during the late 1800s, shifted public health away from its early ties to sanitary reform in the environment. Around the same time, public health boards and departments were being established across the country. While effectiveness varied, some public health boards, such as the New York City Health Department and their diagnostic bacteriology lab, had huge success in using diagnostic science to dramatically decrease the fatality rate of diphtheria and were able to mass produce vaccines and serums for distribution to the public at a low cost. Like most progress, however, this was met with resistance from local chemists and physicians who complained that the low-cost care provided by the government was a direct competition with their private practice. Other governmental boundaries in public health lay in the attempted creation of school health services. While many schools succeeded in having doctors and nurses complete wellness checks on their students, most of the time students wouldn't actually seek treatment, as a majority of them did not have the money to do so. Phase 3, which began in 1910, had an emphasis on education and personal hygiene and the use of a physician as a real force in prevention. In the early 1900s, Chapin, a Providence Health Commissioner, stated that individual cleanliness, such as washing hands, was far more important than environmental filth. He recommended an even further shift away from environmental sanitation towards individual cleanliness, and with this came a narrowed list of objectives for public health. The narrowed objectives of public health included, as stated, an emphasis on education regarding personal hygiene and the use of a physician as a real force in prevention through clinical examinations of the entire population. In fact, yearly physicals were recommended starting in the early 1900s. Health clinics sprang up and, while they mostly focused on education and diagnostics and left the treatment to the actual physicians, there was still resistance in the belief that this could be pushing the boundaries of public health too far. Limits of the rational organization of healthcare in America were set by the defense of private interests. Whenever public health tried to expand, physicians vehemently pushed back. It was common belief in America that the state should not compete with private business. Time advanced further into the 20th century, and medicine began to move away from prevention and more towards treatment. It became clear that public health was splintering from the scope of medical care. It would be interesting to see, Starr remarks, what level of coordinative care might have been achieved had public health not been considered secondary to acute medical care. How do you think healthcare would look today had the division between public health and clinical medicine not become so profound?